Hi, I'm Montgomery Township Mayor Sadaf Jaffer, and I have a COVID-19 update for May 19th, 2020. As of 9 a.m. this morning, we have 100 people who've tested positive for COVID-19 in Montgomery, and sadly, 7 people have died. I also lost a member of my family to the virus over the weekend. Despite this sad news, we have seen a decline in the rates of positive cases and fatalities throughout our state. Governor Murphy has announced some changes, including allowing for the opening of outdoor tennis courts, for more businesses to operate on a curbside pickup basis, as well as opening the state beaches to the public as long as social distancing is maintained. In light of these developments, I wanted to invite the president of the Montgomery Township Board of Health, Dr. Jeremy Grayson, to share his thoughts with the community. Thank you for joining us today, Dr. Grayson.
Thank you, Mayor.
So, in addition to being a resident of Montgomery and president of our Board of Health, you're a physician working directly with COVID-19 patients. Can you tell us about your experiences on the front line and how it informs your thinking about the public health responses and responsibilities of the Montgomery Township government?
Well, first, thank you for having me here. And second, I'm saddened to hear about your aunt. And I give you my deepest condolences, and hope that we see less and less people passing within our community and within our state, in the country and worldwide from this as we make more and more advances. As far as what we see in the hospital, patients are very sick, the ones that come into the hospital. We do have patients that can be treated at home, and the majority of patients do get treated at home. But the ones that come into the hospital end up being very, very sick and require a great deal of care. We have seen over the past couple months a rise in the number of patients that we were admitting on an inpatient basis. And that slowly over the course of March, April, and now into May, we've seen a decrease in the number of inpatients overall, which bodes well for our policies that have been put into place by the state government, having people shelter in place as much as possible, closing most businesses down, and the other policies that have been put into place that have definitely been effective in New Jersey. If you look at the news, New Jersey's had one of the longest stay-at-home policies, and some of the most severe restrictions on what people can do. And that was necessary because we were in such close proximity to New York, and also the second highest rates of infection in the country. So now that we've kind of battled through this initial surge in patients, now we can sort of begin to lift some of the restrictions so that people can get back to doing some of the things that they were doing before, and businesses can open, and the economy can slowly reopen. But that being said, what we want to try to do is avoid doing things too quickly, or having too many people out and about and doing too many things such that the spread begins again. If you look at the other countries that have gone through what we've gone through already and had very successful policies in place to shut stuff down and to really squash the transmission, such as South Korea, Japan, and Singapore, Hong Kong, they put in very robust policies right away, and they were able to slow transmission rate and effectively bang it down very, very quickly. However, once they started to allow things to happen, then people went out, and because people naturally want to get back to doing things the way they were doing it before. And when just one person doesn't follow the guidelines, you run the risk of having a very sharp spike in disease rates. So in South Korea, for example, when they lifted the guidelines, one person managed to infect about 100 people in a very short period of time, because that person decided they needed to go everywhere. And in doing so, infected lots of people. There's also some maps of office spaces and how that moves very quickly through an office if you're in close proximity to people. So we need to keep those things in mind.
Montgomery's own caseload is not nearly as acute as elsewhere, which is very fortunate for us, but that can cause some members of the public to wonder if our public health measures are too strong. What's your perspective on that?
So first, I think that the reason that our numbers stayed low was because of the measures that we took early. I think that sheltering in place had a great effect on us. Plus, because we're kind of a sprawling suburb, the nature of being in close proximity to one another isn't as great. So we had that going for us here as far as how quickly we could pass it from person to person. So we have the open space. We had very good protective measures at the beginning. And I think the danger is to take that as a sign that we're not going to have further outbreaks. And so while we look at the local infection rate and the prevalence within Montgomery Township, we also have to look at what the prevalence rate is in surrounding areas. And if you look at Middlesex County, that has a higher rate. If you look at New York City, that has a higher rate. If you go into Philadelphia proper, there's more cases in Philadelphia proper. So you have to look at where people are working, where their employment is, and what their risk is of going to work and then bringing it back to the community. So when they talk about opening things back up, they look at what local rates are, but you have to look at different Venn diagrams of local. So we have Montgomery in and of itself, but we also overlap in certain areas. There's an area of Montgomery that is going to abut Princeton, and there's an area of Montgomery that's going to abut Hillsborough, and then there's an area that's going to be next to South Brunswick. So when you look at that and the fact that we actually corner on Mercer and Middlesex and Somerset, we're in a place where it's hard to just say Montgomery's case rate is 105 people out of 225,000 people that live in town, and therefore we're good. Closing things may have seemed onerous and may have seemed over the top, given that our infection rate wasn't high, but in doing so, we prevented it from going higher. And I think that we need to look at it from a community health perspective and not just what we as individuals want and need at a certain point in time. We need to take a bigger picture, a more long picture.
Patience with the stay-at-home orders is running thin. Many miss their previous way of life. What advice do you have for residents about how to think about what we're going through and how to increase our endurance for the long and longer haul?
So I totally empathize and sympathize with the notion of, patients wearing thin. I think that it's not just people that are staying at home, but, even as a healthcare worker, I could say that my patience has been frayed many, many times during the course of this, not just from being at home when I'm not at work, but just from the notion of having to deal with more and more sick people as they come in. So, it's hard to be at home and to try to work and to try to take care of your children and their schooling at the same time and maintain a degree of sanity. So I totally understand that people have cabin fever and want to get out. I think that the way that what you need to do is you really need to put the whole thing into perspective, because we're doing this to prevent people from getting really, really, really ill. So really, really, really ill means you come visit me in the hospital or one of my colleagues and the ICUs or the floors, and you end up needing supplemental oxygen and you may need a breathing tube. And when you put the breathing tube in, the odds of it coming out are very, very, very small. So, that's a hard thing to swallow, knowing that if you do get sick, there is a small chance that you'll end up in the ICU with a breathing tube that may never come out. And also without anybody there with you, which is incredibly unnerving. For me, having to put patients to sleep and put breathing tubes in them, I'm maybe the last person that they see in their life. And they're not going to see their family, and their family's not going to get to see them again, and that's hard. So I think that's one of the things that keeps it in perspective for me, as far as knowing that when I come home, I have to be at home. I can go out and do things that are essential. Um, and I think even with things opening back up again, that we need to really be careful with our interpretation of what it means to have the rules relaxed. The rules being relaxed doesn't mean that it's a free for all in the parks and you can play. And I do know that over this week, it was a beautiful day yesterday and Friday, and it's nice again today. And people were at the parks, but they weren't everywhere doing what they were supposed to do, maintaining 6 feet distance, wearing masks if they were going to be closer. People were playing sports. People were riding bikes close to one another. People were jogging with other people that were not family members. And this is where we're going to run into problems. And it's hard for people to grasp that that's the case. But it's not hard for me, because I see what happens when people don't grasp it. And even if you're in the majority and you get sick and you don't end up needing to come to the hospital, which is great, and you're able to convalesce at home and get through the illness, there are potential long-term sequelae to this illness that have been gradually coming to light as people have recovered and continued on. People's lungs don't feel good for months. They have trouble breathing. They don't feel necessarily right. There are people with other organ dysfunction that persists. So we have to go beyond just thinking about it being that you can be an asymptomatic carrier, or that most people end up being fine and they recover from it, and it's just a really, really bad cold or a really, really bad flu. We need to think of it more as its own sort of entity, which has a clinical course that is incredibly variable from person to person, the reasons of which we're not entirely sure, and also has a wide spectrum of being fine to having to dying from it. And also keep in mind that should you get it, or should you have it and not know, you can pass it to other people. Like that concept and that truth has not gone away, despite the fact that within the state of New Jersey, our new admissions have gone down below our discharge rate, which is why we can open things up. So our discharge rate has now increased beyond our admission rate. And when you look at the averages over a 7-day period, that's been going on for about a week and change now, which is why Governor Murphy has relaxed some of the restrictions, because we now have the capacity to deal with people coming into the hospital who can't follow the rules, or who may have gotten inadvertently sick in where they work, or from commuting outside of their known local area, and then bring it back in. And then the next thing you know, you have a spike within a population. So we just really, really need to be careful. You need to be mindful of that. I am a strong proponent of masks. I have been a strong proponent of masks from the outset of this pandemic. And I think that if you're going to be in public and you're going to be close to anyone, and we use a 6-foot radius, but I really think it's better to err on the side of caution and have it on for further. If you see somebody, then you can have it on. If you're in an open field, sure, you can have the mask off. If you're at the beach, because you're fortunate enough to have a house down the shore and you have a beach badge and you can go there for the summer, you really need to be careful about taking it off around certain people. Yes, 6 feet away. Yes, it's the summer. We think maybe it's less transmittable because UV light may kill it quicker when it's in the air or it lands on surfaces. But we really don't know what happens in life. We only know what happens with what we've seen in labs. And that's the difference between something happening in vivo versus in vitro. And we have to know what happened in vivo, meaning in us, versus in vitro in a lab. And that's the same for any of the treatments that we've seen also. They had decent results in vitro with a number of the things, but it's been proven with every treatment that we've tried so far that in people, it's not effective. And so we still don't have an effective solution to this from a medication standpoint or a vaccine standpoint. And without that, we need to kind of keep these safety mechanisms for ourselves and for our community, for our state, and for our country and the world in place.
So thank you so much for sharing your experience and your expertise and breaking it down in a very understandable way for all of us. Do you have any final messages for the community as we all go through this experience together?
First, you're welcome. And again, thanks for having me on. I appreciate the opportunity to speak to the community. And also would say that if people do have questions, I'm more than happy to answer them. I think that the more informed we are and the better answers that we get that are truthful and based in fact and not coming from social media and not coming from YouTube and not being propagated via meme, I think the better off we are. So that's one of my messages mainly for most people is that you have to stop getting news from sources that are not news. And that even includes what's considered the mainstream media and even reputable mainstream media, because the goal is to take medical studies and to make them into digestible sound bites so that the public can understand them. So as a example, there was a study published in the Journal of the American Medical Association ahead of print about the situation in one of the New York healthcare systems, which looked at 5,800 people or so. And the headline that they took away from that in the newspapers and on the news was that 88% of people on ventilators died. And therefore there was an 88% mortality rate. But if you read the study, you would have known that that really was an overstatement of what was going on, because the population that they were looking at had not completely gone through the system yet, meaning that there were still patients on ventilators that hadn't passed. There were still patients that they were treating that hadn't been discharged. So when you say that an 88% case fatality rate from people on ventilators, that's sort of overstating what the data is showing thus far. And that study was since redacted. So I think that we need to be very careful about what we believe that we hear, even from sources that we consider to be reliable. And, I am fortunate enough to be able to read the journal articles and to actually understand the statistics that they're using and understand whether or not it's a simulation versus real, and then can compare that to other studies that are coming out at the same time and make some decisions. The people that are reporting this news to us are not doing the same thing, even though they have medical editors, that check for content. These things still slip through the cracks. And then the next thing we know, it's gone quote unquote viral, which to me is an ironic thing, that we're suffering basically with the viral transmission of a virus alongside the viral transmission of erroneous information on a day-to-day basis about the virus. And I think that that's dangerous. And I think that we need to really allow the people that are in healthcare who can read the literature and can guide policy to do that, and to not make it political and not make it sensational, but to make it what it is, and to explain it to the public in such way that they understand the gravity of it and also understand why such safeguards are in place. Not because we're looking to scare anybody or because we're looking to take away people's rights or to make them stay at home or to make them not live the way that they wanted to, but because we need to look out for individuals and the communities, and we need people to understand that that's what's going on here, and that there are other things that can happen between now and 6 months from now, a year from now, that may allow us to really ease things totally, which would be a increased infrastructure as far as the number of ICU beds and hospital beds we have for potential patients. We could find a vaccine in the next 18 months or so. We could find an effective treatment that, when taken, would stop the viral replication in the body such that it is eradicated. And we could ramp up something called contact tracing, which would allow us to find somebody that has it, and then the people that they came in contact with, and kind of cordon those people off, quarantine, so to speak, and prevent them from spreading it more. But without contact tracing, and without an increased number of beds, and without an effective treatment or a vaccine, we're kind of stuck with this slow sort of wave of an ebb and flow of allowing things, and then not allowing things, allowing things, not allowing things. And then the other thing that needs to happen also is we need to have a better way of testing people, both for the acute presence of the illness and also convalescence from the illness, because the tests that we have currently are not really great as far as their sensitivity and specificity, meaning the number of false negatives and false positives that we have. And the antibody test suffers from the same thing. And in fact, there are medical societies that don't recommend using the antibody test at all. Now, I do understand members of the community wanting to know and to get it, but they need to understand, and everybody in the country needs to understand, that taking an antibody test and seeing that you do not have antibodies does not mean that you did not have the illness. And taking a test for COVID with a nasal swab or sputum and having it come back negative does not mean that you didn't have it. We've had many patients hospitalized that have had negative test after negative test, but have all the signs and symptoms of having COVID. And we just, at this point, know that there is some drawbacks in the testing. One last thing to let people know about is that there are a number of companies that have popped up very rapidly offering tests online. You'll get emails about them now, and spam phone calls and text messages saying that we have this test and it's only $10, and we will mail it to you, and the results will be known very quickly. Be very wary of any of those sort of offers, because there are very few tests that are FDA approved right now. And even the Abbott at home FDA approved saliva test still has a lot of issues as far as its sensitivity and specificity. So if you're not using it from a reputable source and you're not going to your doctor to get it, I would be very mindful of not using those things to determine whether or not you're quote unquote safe. So I do welcome anybody, if they have more questions, like I said, to let the town council know, or let Mayor Jaffer know, and we can do this again potentially, and maybe come up with another form where I could answer questions for people, because I do like being able to be helpful and answer the questions, since I see it both acutely in the hospital, in the community, and then also as a public health official. So thank you very much. I appreciate it.
Absolutely. Thank you so much, Dr. Grayson. The public is privileged to have people like yourself volunteering to protect the health and well-being by serving on our local Board of Health. And my takeaway from a lot of the things that you're talking about is that this isn't going to be something with a quick solution where, suddenly there's a magical cure and everything is fixed and we know everything about the virus and we're all knowledgeable about whether we've been infected ever. It's that we're in the process of developing these things, and there will be setbacks, there will be advances. And we're so thankful to the public for being consistent, for implementing the physical distancing, and for wearing their masks. That really does protect everyone, but we have to stay the course. It's really important to stay committed to this. And even as things open up, to be cautious and conservative. And as you said, not suddenly go to 10 places on the same day, or, hang out with everyone. Just be very slow and methodical. And that's exactly the way that we are trying to approach this as well, to be as cautious and careful and mindful of the impacts that every decision that we make has on the health and well-being of the residents of our township and beyond that. So thank you so much again, and take care.
You're welcome. Thank you. And also people should be considerate and kind as much as possible as well, so that you're not being mean to somebody because they're wearing a mask or they ask you to put a mask on, and vice versa. I mean, we don't want the confrontations that I've seen in other areas in the country to sort of escalate. And that is a concern that I have, even here in bucolic Montgomery.
Yes,
You
I
have
think
concerns about vigilante justice and people sort of taking the law into their own hands because it's one person's rights versus another. I think we all are in this together, and we should think about it like that as much as possible, and that we're protecting each other as a
yes,
community.
I think that that spirit of a sense of community and giving people the benefit of the doubt and realizing again that none of us has all the answers, that we are working towards something and we're all doing the best we can. That's certainly the way that I approach, my interactions with the community, or I aspire to approach things in that way. And I hope that we all can learn from that. So thank you.
You're welcome.